Hi, I'm Mike Antal. I am the instructor for the shoulder course for Great Lakes Seminars. Today, what I want to go over with you is upward rotation of the scapula. This can be a big dysfunction for a lot of our patients, especially the ones that we find that have abduction impingement. 0 to 30 degrees of shoulder abduction comes primarily from the glenohumeral joint. Once we get above that 30 degrees, we need the scapula to begin to upwardly rotate. In many of our patients, we find that there's a limitation with upward rotation, creating impingement as we get higher into the range of the motion. So what I'm going to do is demonstrate upward rotation of the scapula. So when the patient, if they have 90 to 100 degrees, if I can take up the slack by bringing them into some abduction, that's going to help me through my mobilization of the scapula. First thing I want to do is I palpate for that inferior angle of the scapula. My superior hand here is just guiding. All right. The first thing, we're going to set the scapula. I just want to make sure I've got my patient out of a protracted position. The second thing is to do a slight inferior glide posterior tilt. We need that portion of the scapula with this motion. Upward rotation, I side bend, pulling up on the inferior angle. Throughout this entire technique, I'm feeling for the restriction of the muscle that is holding the scapula. So at this point is where I feel it stop. Now what I'm going to do is I'm going to ask my patient to hold and keep me from moving the scapula anymore. So I'm going to try to pull up. Don't let me pull. 6, 5, 4, 3, 2, 1. Good. Relax. And then I see if I can bring them a little further, and we gained a little more range. Okay. This technique is very effective in helping the patient to restore greater pain-free range of motion with abduction of the shoulder. Thanks.